everyone. Hello, everyone. I'm Dr. Karen Duderstadt. I welcome you with great pleasure to the second session of our nursing course, Nursing on the Front Lines of the Climate Crisis for Action. Today is session 2 of our course, and the topic is just transition. In a moment, we will be hearing from our speakers, our experts, our nursing experts, Dr. Barbara Sattler and Dr. Gina Friel. We will be having closed captions. If you want to advance the slides, we will be having closed caption. We are pleased to offer that today. For English captions, you can click on the button on the bottom of the Zoom, and we also have Spanish captions available. There should be a link in the chat for those who want to use Spanish caption. I'd like to thank our course partners. I'd like to express gratitude to them and all that have had a role in the development of this course. Oh, here actually you have the list of the just transitions. Now we'll go on to course partners. I would like to express gratitude to our partners and all that have had a role in the development of this course. We're all here today to increase our knowledge and self-efficacy and to improve our communication and to develop improved strategies for advocacy and action related to the climate crisis. Thank you for all the support from our partners and supporters. First, I just wanted to have a few reminders. Attendance is automatically recorded during the live Zoom sessions. Please note that attendance is not counted if you join with a colleague's link. Now I wanted to mention something about the video recordings for the session. The session is being recorded, and following each session, attendees will be directed to the Alliance of Nurses for Healthy Environments, our platform of learning environment. Here's the link. And also here you have the QR codes in the chat for the registration for the Annie site as well. The site is also accessible through these QR codes. This is important for participants who would like to obtain a certificate of participation or for our US-based participants who would like to obtain continuing education credits. The directions for how to access the recordings can also be found. So I wanted to mention some information about the final. We can advance the slide. The final exam will be a 20 multiple choice true and false test. The participants must take the exam in one sitting using the same email address used when signing for the course. The exam will be sent on the final day of class via email and WhatsApp. The exam will open on Tuesday, December 2nd and close on Saturday, December at midnight in Eastern Coast time. The exam will not be reissued after Saturday, December 6th. And for those who want a certificate of participation, you need to attend at least 7 out of 10 live Zoom sessions or view the recordings and pass the course final exam with a score of 70% or higher. Asynchronous views after December 2nd.
Will you be recorded?
The Nursing Continuing Education course, we will receive CEs, attend a live webinar session or view the recording session asynchronously, and receive at least 80% of the post-session evaluation. Participants do not need to complete the CE process in order to receive a certificate of participation. For the passwords, you will be sent a password code for the session that you attended, and these will be sent, all of them will be sent prior to the end of the course. Session 1 password code should be coming in the next several days.
Bukan, Bu, dia itu udah ngasih duit.
For the session logistics, I apologize, there seems to be a problem with my mute button. The session logistics 60-minute session. Sessions will end with a question and answer section. Enter questions for presenters in the Q&A and not in the chat. The session slide decks and resources will be available on the course website. The video recordings will be available on the ANNI website. The course website QR code and website link are in the chat, and also one of the links is available here. And now to introduce our presenters, Dr. Barb Sattler and Dr. Gina Friel. Dr. Barb Sattler is a professor emeritus at the University of San Francisco and an international leader in environmental health and nursing. She's been an advisor to the US EPA's Office of Child Protection and the National Library of Environmental Health. Through her role with the California Nurses for Environmental Health and Justice, she's been educating. She has been educating and engaging regarding a wide range of environmental health issues, including climate-related risks from heat, extreme storms, flooding, and fires and smoke. Dr. Sattler has been involved in the disaster response in her local community, as well as nationally through the Medical Reserve Corps and Friel University. Dr. Sattler is a registered nurse with MPH, a doctor in public health from the Johns Hopkins School of Public Health. She's a fellow in the American Academy of Pediatrics, and she was a professor at the School of Nursing, where for over 20 years she directed the environmental health and spearheaded the founding of the Alliance of Nurses for Healthy Environments. Then I'd like to introduce Dr. Gina Friel. Dr. Gina Friel received both her Bachelor in Science and Doctor of Nursing practice from Villanova University School of Nursing. She's a certified pediatric nurse practitioner at a practice in Maryland in the US, and she provides care to pediatric patients from birth through 22 years of age. In pursuit of her passion for climate and health, Dr. Friel was the first nursing postdoctoral fellow Global Consortium of Climate and Health Education at Columbia University Mailman School of Public Health. During her fellowship with the Global Consortium, Dr. Friel was the co-founder of the Nursing Climate Resources for Health Education. Currently, she is director of the Global Nurses Working Group at the Global Consortium. Her main focus in this role worked collaboratively with the GCCHE and a wide team of nursing professionals who have joined together to pursue the groundbreaking work, building capacity, and providing educational opportunities in climate and health for nurses globally. In the fall of 2024, Dr. Friel led the development and implementation of the first global nursing course, Nursing on the Front Lines on the Climate Crisis. I think many of you did participate in that initial course as Education for Action. This course reached thousands of nurses in at least 133 countries, spanning 6 continents. So welcome to Dr. Barb Sattler and Dr. Gina Friel.
Thank you so much, Karen. And Karen, if you can give me a thumbs up so that I know that you can hear me. Okay, I see it from Gina.
Yes.
Great. Thank you so very much. I'm delighted to be here. And how many people are on today? So let's get started about just transition. And let me make sure I can forward my slides here. So I do not have any vested interests in anything. And what all of us know and what we've talked about many, many times now is that we need a number of transitions to happen, and we need to get off fossil fuels. This is the biggest contributor to greenhouse gases. You hear this in every single climate change talk. We need to move towards renewables, electrification of everything using renewable energy. This is something that we all have heard a zillion times. But what we also need to recognize is that there have been a lot of economic transitions that we've had in the past. And we can learn from some of these transitions because some of them we didn't do quite as well as we could have, certainly from a nursing perspective. And so I'd like you to just consider what happens when a whole industry leaves a community. I was living in Baltimore at the time that all of our steel plants big, huge Bethlehem Steel, US Steel plants closed down because two reasons. One, we stopped making steel things, big bridges in this country. Most of them were built, before the 1960s or 70s. And so starting in the 80s, we didn't have the demand for steel. We weren't making these giant high rises the way we were before. And so what happened in Baltimore when these huge anchoring industries left, thousands and thousands of steel workers who were unionized workers making good pay with good benefits, including health benefits, suddenly lost their jobs. This was devastating to the communities where I lived. And what we saw at the time, and the two communities, Dundalk and Sparrows Point, were the most impacted in my community. You're going to hear from Gina about her community specifically with regard to coal. And so what happens from a nursing perspective is the whole community and the social infrastructure within the communities explode or implode. And we see the kinds of things you might expect: depression, domestic violence, anxiety among everybody in the family, not just the worker, but the children and everybody, increased suicidal ideation and suicide, substance abuse, alcohol, behavioral problems, particularly in the children, and then displacement. So what we know is that we have lost a lot of industries in this country. They went offshore, meaning to other countries where workers are paid less, don't have health insurance, don't have the kinds of benefits. And so we lost the textile industry in this country substantially. The toy industry, the shoe industry, the clothing industry, of course, steel that I just mentioned, many of the automobile industries moved to Mexico and other places, and we lost the logging industry. In some instances, these were polluting industries, but they were also industries that employed many, many people. And you'll see in the map on the bottom right, this area where we lost a combination of the steel industry and some of the coal industry.
Barbara, can you unmute yourself? Because I will ask you all the participants to keep your microphones off.
Sorry, I had to. So I'm not sure when you lost me, so I'm going to just start from this slide. But the fossil fuel industry in the U.S. and I didn't Google lots of other countries, but in the U.S. we have over 2,000 workers in the oil and gas pipeline construction. And you can see the other statistics here in terms of how many workers actually work in the industry. 55,000 in the oil refinery industry, and I'll be talking about that later. And then 139,000 workers in oil and gas extraction. That means drilling. Most of these are union jobs. Many of them pay very well. They also have benefits and health insurance. This is really important for us to understand because these folks are paying mortgages, paying car payments, paying sometimes for their kids to go to a Catholic school or some kind of private school, paying for their kids to go to college. They're doing all the things that we want them to be doing to support good, solid middle-class communities. And these are examples of what has happened in the coal industry. I want you to know that in the 1950s, we had 350,000 coal miners in this country, in the US. By the 80s, we had 200,000, and now we have 43,000 coal miners. Do we want to get rid of coal? Absolutely. But we don't want to trash coal miners and coal mining communities in the process. We want to have a plan. And once again, that same list of maladies that we see in communities where an anchoring community has an anchoring industry has been yanked out from the community. We see lots and lots of pathologies in those communities. And so what has happened is that over the last 10 years, we have closed down 300 dirty, dangerous coal plants and retired them in the United States. Now, that's a win for those of us who breathe air and a win for the environment, but it is a loss to, as an example, this third generation coal mining family. They've lost their income. They've lost their mortgage security. They've become food insecure. They lost their health insurance. And for many in these industries like steel and coal, the worker loses their identity. And this is really important for those of us in nursing to understand how this impacts whole families and whole communities. And so I'm going to pass this to Gina now, who's going to talk specifically about how this affected her and her family in the town of Hazleton, where she was born and raised.
Thank you, Dr. Sattler. Can everyone hear me?
Yes.
Okay, great. Thank you. I'm so happy to be here to share a bit about a town in the northeast part of the state of Pennsylvania in the United States. The town is Hazleton. Hazleton is the highest city in the state of Pennsylvania. It is near the Pocono Mountains for all of you skiers out there. You may have heard about Hazleton, read about it, or maybe perhaps you visited there, or maybe you grew up there like I did. As I begin to share about this special place, you will initially see this community through the eyes of a child who grew up there. And then you will see how this example is connected to a wider challenge, or more importantly, an opportunity for us as nurses to connect the health of our shared climate to our own health and to the health of our patients and families. Next slide, please. First, some background. In the mid to late 1800s and early 1900s, Hazleton was the heart of the anthracite coal region. Anthracite coal is a fossil fuel. It is a special type of coal found in this region, but it can also be found in South Africa, Australia, Eastern Ukraine, Western Canada, and in China. During this time, coal was the heartbeat of the Hazleton area. And it quickly became a booming economic industry to Hazleton and to the surrounding communities. On the left of the screen is a photo of Milnville number 7 breaker taken in 1902. You can see the numerous miners and coal slate pickers that were employed there in this photo. And on the right, of course, is a picture of anthracite coal. Next slide, please. Coal was a part of our lives. At that time, coal was used for many different things, such as cooking, heating, and powering steam engines. On the left of the screen is a picture of my great-grandmother, proudly displaying her beautiful pretzels in front of her coal stove. On this coal stove, she used to cook the most delicious Italian food. I could still smell her fresh sauce, and I so wish that I could taste it once again. She used to cook for her children, her grandchildren, her great-grandchildren, and for me and my cousins, some of whom are pictured here at the kid table, as we called it, on the right. Next slide, please. Coal was used to heat our homes, our schools, and our places of employment. Next slide, please. Here are 2 pictures of paintings done by my great-uncle. On the left is my great-grandmother putting coal in her coal stove, and on the right is a painting of what that coal stove used to look like. Perhaps it may look quite different from what some of our stoves look like today. Next slide, please. Coal was used to power the steam engines for the railroad where my great-grandfather worked, seen here pictured on the right. And on the left of the screen is a picture of the steam engine that he worked on and the employees with whom he worked in 1940. The coal mines and the industries that it supported employed thousands of individuals and brought in millions of dollars of economic growth. Next slide, please. As the coal industry in Hazleton grew, so did the population. Census data shown here on the left demonstrates how the census blossomed from the 1860s to a peak in the population at a time when the coal industry was booming in the early 1950s. In the center of the screen is a photo of the main street in the downtown area at the time. On the upper right of the screen is a photo of a beloved local amusement park. Hazleton was a growing town. It was bustling with an expanding population to not only fill the department stores, but also the abundant amount of gorgeous churches that were built in this community. Next slide, please. Hospitals, restaurants, schools, shops, and bakeries with a wide variety of ethnic cuisine were also established, reflecting the diversity of the population at the time. The availability of jobs in the mines attracted workers and families to this area, many coming from international locations such as Italy, Ireland, Germany, and what was at the time known as Slovakia. In 1941, the town celebrated its growth as the largest anthracite-producing colliery in the region. In 1960, John F. Kennedy campaigned for the presidency, drawing one of the largest crowds in the city's history. Next slide, please. But the work in the mines was difficult and dangerous, and unsafe working conditions were the norm. Each year, hundreds of coal miners lost their lives or were seriously injured. Major mine hazards such as explosions, fires, and injuries occurred, sometimes up to 800 feet below the Earth's surface. Many of the miners later developed what is known as black lung disease. Next slide, please. Beneath the ground where the miners worked, there was a city beneath the city. In his amazing documentary, Justin Emershaw highlights that the miners worked 8 to 12 hours a day. And the miners needed to have all of their means of support just underground, just as what you and I might need to have our work above the ground. There was a system of railways, street signs, mule stables, hospitals, offices, logbooks, an emergency hospital, and even a stretcher was discovered. And that is seen here in the center right of the screen. Next slide, please. In the early 1900s, women were barred from working underground in the coal mines, but their work above ground was essential. Residents of the coal region sought care from diverse practitioners, including neighborhood women, and also from various places depending upon availability and cultural preferences. In 1878, the initiation of occupational health nursing, as we now know it, originally began in the UK with Philippa Flowerday. In the US, Betty Mulder is credited with the beginning of occupational health nursing. She was hired in 1888 by a coal miners group to care for the employees and their families. Nurses were on the front lines caring for miners and their families then, just as we continue to be on the front lines today. Next slide, please. In the early to mid 1950s, two things happened. First, sales of coal in this region decreased due to competition and other changes in the coal, oil, and steel industries. But probably the most devastating blow to the anthracite coal industry in this area was Hurricane Diane in August of 1955. A record-breaking amount of rain, just over 11 inches, fell onto Hazleton within a 23-hour time frame. Creeks and rivers rose, basements and streets were flooded, And despite what was thought to be an adequate safeguard against the torrential rains, the deepest underground mines also flooded. And without the availability of financial assistance at the federal level, the underground mining operations were unable to continue as they knew it. Next slide, please. This resulted in a transition for the coal industry from underground mining to mining above ground, and this still continues today. But at the time, during the transition, the unemployment rate rose to almost 30%. Many businesses, churches, schools, restaurants, bakeries, the maternity hospital, and our amusement park eventually closed over time. And despite the intentional placement of a major highway system connecting Hazleton to the north, south, east, and west coast of the United States, many of the people living in Hazleton transitioned to different areas, carrying with them future generations and future ideas for this beautiful city. And what took about 90 years to build then took another 40 to 50 years to build again. This time with a new generation of Hazletonians, as the population is now beginning to rise toward the levels seen during the peak of the coal industry. Next slide, please. Jobs in manufacturing, shipping, and other business endeavors, attracting a new population of people bringing their ideas for stores, businesses, and industries, providing jobs in places such as an Amazon warehouse, a water bottle manufacturing facility, and also a facility that produces packaged lettuce, which is sustainably grown through controlled environment agriculture. I would like to now hand it back to Dr. Sattler, who is going to share more thoughts on how we as nurses on the front lines can bring our trusted message and, more importantly, potential solutions to the table as we move forward in caring for our health of our communities, patients, and families. Thank you.
Thank you so much. That was really a vivid picture for us of what happens to a community when it's robust and has a wonderful anchoring industry, and then what happens when it leaves. And I want to just reiterate, it's taken 40 years for Hazleton to come back. It looks quite different now, and it's got a completely or substantially different population there now. So I want to shift back to the fossil fuel industry, not coal, but the gas and oil industry. And one part of that industry includes refineries. And I have a map here of where the major refineries are in the US. And what we're seeing right now, because of they are another anchoring institution. So that middle picture is a refinery. It employs lots of employees. They are mostly unionized employees. They get good pay, good benefits, et cetera. And so we're starting to see these close because we have less demand on oil and gas, which is a good thing. But what does that mean to these communities? And what does it mean to the 55,000 workers specifically in the refinery industry? Now in California, 2 of our refineries have closed. And even in Texas, one is in the process, the Lindell Basel Houston refinery is in the process of closing. And globally, 101 refineries are now predicted to close in the next decade or so. Now, we know that refineries are not something you want to have in your backyard. The bottom right is a photograph from last week when the Chevron refinery in Los Angeles exploded and stayed on fire for a day or two, causing evacuations of a large swath of communities around them. They're not a good industry to have. On the other hand, they employ with good salaries a lot of people. Another thing that we've discovered, and I gave a talk in Bakersfield, California, which is the picture you see right there are the oil fields in Bakersfield and Kern County, which is sort of the epicenter of California's oil drilling. And I talked with the public health nurses from Kern County Hospital. I apologize, Kern County Department of Public Health. And what they said is that their government, their county government, really depends on the taxes and the tax revenues from the oil industry. And should that revenue go away, should we actually get rid of oil extraction in their county, that's going to mean a big reduction in their taxes and therefore a reduction in services that they are able to do. And so, in talking with these nurses, they who are very involved in the work that they do, with clinics, with the Latino community, with mental health services. One of the nurses who actually works with people who are sex trafficked and trying to find them safe haven, she said, she assumed her program would be one of the first to leave. So we need to think about how we continue to support the communities if we're telling them they can't drill oil anymore. I want to just shift a little bit. I don't know how many of you are old like me, but this was a movie, The Graduate, in 1967. It won 7 Oscars. Very, very important movie. But one of the things a little comment that was made in the movie by one of the actors who spoke to Dustin Hoffman was, if I can give you just one word in terms of what you should invest in, remember this movie was in 1967. He said, it's plastics. And so what I want you to understand is that plastics are now the oil and gas industry's plan B. As they are seeing a reduction in our demand for oil and gas in terms of vehicular needs, they are really promoting bigger and more use of plastics. So you of course know that plastics are derived from fossil fuel. It's a fossil fuel industry. And the fossil fuel industry is predicted, and I apologize, the fossil fuel industry strategy is predicted to increase plastic production by 50% by 2050. And so that's for all products having to do with plastics. And I'm sure you know we are awash in plastics, and that just seems to be increasing and increasing. And the majority of them, including with our food services plastics, are not, but they're not compostable or biodegradable. They are winding up. And they are also insufficiently being recycled if they are claiming to be recycled plastics. So we have a fossil fuel problem in the form of plastics in our country. And I just want you to know that Legos, I've got 2 grandchildren, we've got piles of Legos because of them. Well, originally Legos were made out of wood. And it wasn't until 1949 that they made the first plastic ones. There have been 1.1 trillion pieces of Legos that have been manufactured in the world. That's 140 pieces per person in the globe for Legos. So we have just continued to manufacture these plastic items that once again were once wood. And why couldn't they be something like wood again, which is a renewable resource and completely biodegradable? A new factory, in fact, a new Lego factory is going to wind up being built in Virginia in our country. And you can see the other countries where they currently have Lego factories. So what the industry is hoping to do is have a 5% increase annually from now infinitum. In healthcare, when I first started working in healthcare, we didn't have plastic anythings. We had stainless steel, which of course lives forever. We had bedpans, emesis basins, everything was made of stainless steel. It is still possible to buy these products in stainless steel, but the plastic industry compelled us to why it would be better to give our patients these plastic things and then, of all things, send them home with them. Well, I don't know what even the most creative person can do with a bedpan at home. So for those of you who also are not old, what happened with these stainless steel bedpans is we had these things called hoppers that were plumbed into the wall. So you would take the bedpan, you would put it in this item, close it up, hit the lever on the bottom with your foot. It would wash and sterilize that. So when the light came on, you could go and grab a sterile bedpan. Now, you're still using water. Now we use water, and the nurses or nurses' aides or others have to take that plastic bedpan and clean it in the toilet in the patient's bathroom. And it makes mess and it gets, sprays all over the place. So the co-benefits just alone of the inconvenience of how we have to handle these plastic bedpans now versus how we could if we thought about redesigning healthcare and using not single-use, but multiple-use devices in terms of these durable goods. So the co-benefits of us reducing fossil fuel-related plastic products are that we'll use less fossil fuels. There'll be less plastic production, which is dirty production. But I also want you to know that it also will mean less micro and nanoplastics everywhere, including in our bodies. And so you can see the bottom left shows us that it is the plastic containers and plastic water bottles and other drinkable substance water bottles that are the biggest, that are providing the largest plastic footprint. But you can also see pictures here where plastic is being found in the human body. It's also being found in the placenta. It's being found in our brains. It's being found in our mitochondria, nanoplastics. There are currently some new laws around the country. We've got one in California that are putting the burden of recycling on the plastic industry, as opposed to having our municipalities and our cities, states, counties being responsible for recycling them in final disposition. The plastic manufacturing in the United States employs 670,000 people. And this map shows you where these plants are. Once again, we want to make sure if we're going to stop using this much plastic that we take care of workers as we diminish their work. We want to make sure that we have a plan for all the transitions that are going to happen because of the things we need to do for climate change. What are the co-benefits of climate change? These are very familiar to you, right? These are the basic co-benefits. If we have public transportation, we decrease risk of cardiovascular disease. If we have more plant-based diets, local food, regenerative agriculture, if we use less fossil fuels, if we shift our industrial practices to be less polluting, if we conserve energy and plant trees, all of these put together, we'll see less diseases, we'll see less health risks. But I'd like you to also consider, what if we begin to think about good climate-related just transition policies? What if we decide that having healthcare for all in this country builds resilience and will take care of all our transitioning communities? And there are going to be a lot of them. What if we saw this as a climate change policy that will take care of everybody as we make the transitions that we need to make? What if we understood that the social safety nets that we have in this country are essential for equitable, just, healthy, and safe climate change transitions, and that we have federal and state shared support for these transitioning communities? We need to build economic resilience in our overall country and countries as we shift our economy. And we may want to begin to consider, as nurses, what about universal basic income? And for some of you who have not heard that term, universal basic income is actually a policy that's happening in different countries in the world and in different parts of the United States. And it is just kind of what it says. It says that everybody should have a minimum basic income. They should be able to afford a place to eat. They should be able to afford to eat good, substantial food. They should be able to have access to health care. How can we ensure, as we make an abundance of transitions. And I'm just going to mention here, but it's really important to consider as we move more towards robotics capability and AI capability, we are going to see many fewer jobs from everything from farm working to the tech industry. And so how can we begin to think about building resilience overall in our economies as we make a lot of different transitions? I believe that nurses have a role to play in creating just and healthy transition policies and practices in all our communities, in our states, and in our nations. And that we have a role in creating a caring economy. Caring economies mean resilient communities. We know that resilient communities can resist and endure the kinds of changes that we're seeing with climate change. These are really important conversations for us to have in our climate change conversations. We can't just say we have to get off fossil fuels. We have to say what happens to our fossil fuel community, colleagues, brothers, and sisters. So our theory of change may want to shift. We need to bring our best systems thinking to this work. How are we going to work in coalitions? Those who are already working on climate, on just transitions. Work with labor unions. Work with our unionized nurses who work within the labor movement. Amplify transition messages when they're happening in your cities, states, counties, nations. And when they're not, take the lead in starting these conversations. Take the lead in your communities, within your nursing organizations, within your work on climate change. Make sure this is now part of your climate change discussion. So for those of you who are interested in continuing this discussion, and I hope you will in this forum today, also join in with your comments and questions. But for those of you who are interested in continuing this conversation with Gina and I'm leaving you with our email information here. And with that, I want to thank you so much for considering this at what I would consider is probably a new component of our climate change policies, practices, and discussions. And so thank you very much. And I hope that we've instigated some thinking on your behalf. Thank you.
Thank you, Dr. Sattler. That was really an excellent presentation. And Dr. Gina Friel for the really vivid town. So there are many congratulations here on the slides, which I see, which is very, very thoughtful. I do have just a few questions, and we have about 10 minutes for questions. So I wanted to start with a few. One of the first ones we have are, what are some of the most urgent health risks faced by people living in extraction sites?
You mean currently living in extraction sites? Yes. So, well, and I'll let Gina talk about coal because she did a little deep dive into that. But I can tell you from the perspective of fracking and from the perspective, and thank you for all the hearts and hands, by the way, floating through the screen.
Thank you.
That we know, whether it's fracking or extracting oil from the ground, that there are increased reproductive health risks, increased cardiovascular risks, increased asthma in children and adults, depending on proximity. We know that children who are born to mothers who live close to fracking sites have higher risks for birth defects, low birth weight babies, premature babies. There are many, many studies now that help us to understand the risks of living close to, whether it's an extraction site from fracking or oil and gas or a refinery site. And Gina, perhaps you would tell us just a few of the health effects that you know associated with living near coal mines.
Yeah,
including mountaintop.
Yes. Thank you for that question. You know, I think what we have learned over time is that fossil fuels harm human health at every stage of the life cycle, from extraction to refining to transport, storage, combustion, and the post-combustion waste. And every stage releases toxic pollutants that are devastating to our health, and our health at every stage, as you said, from birth with premature risks of low birth weight to prematurity to miscarriage. There is some risk of childhood leukemia and asthma and cardiovascular disease and cancer and strokes. And I think one of the major takeaways that I hope you just all remember from this is that the fossil fuel industry is having impacts on our health and the health of our patients and our families and our communities. And it's persistent over time. And we're still seeing some of the coal miners who are having experienced what we call black lung disease. And, I'll share with you just a very personal story. My father-in-law recently passed away, and before that, he had entered into hospice. And when we were doing the paperwork for hospice, one of the very first questions on there was a question related to black lung. And, we are not in anywhere near a coal manufacturing plant, but that was one of the questions that was on that paper for hospice. And so we're seeing these health harms transcend generations, and we're seeing them today. And that is the real thrust of this discussion, is that, the fossil fuels are affecting our health. And that's what I hope you take away from this conversation.
Thank you. We have several more questions, so I'll just move on to the next question. Can you explain the effects of nanoplastics?
Sure. This is a really growing area of interest to scientists. So there are the plastics that we see everywhere. You've seen the pictures of them mounting up in our beaches, mounting up in our rivers, in our neighborhoods. And then there are microplastics, which are small particles that wind up being created, particularly in the oceans, but also created. We have clothes that we wear that are made from fossil fuel derived chemicals. And when we wash them in our washing machines, microplastics are created. And though we cannot see those, they are so small. And nanoplastics are sometimes intentionally put in products, and they are even small. And these are so small that they wind up in our water and in our foods and our food containers and then into our food. They are so small that they're actually able to cross the placental barrier, cross the blood-brain barrier, cross the cell wall, and wind up in our mitochondria. They're winding up within our cellular structure. So when you ask what are the health effects of this, for much of it, we don't know yet. But we're beginning to see science. And if you just Google microplastics and health, nanoplastics and health, or Google Scholar, you'll begin to see what is a growing literature of science and scientific endeavors right now, trying to understand the link between seeing these visibly in imaging, the microplastics, and then trying to understand what kinds of increased risks this is going to mean. When we see microplastics in children's brains, I don't think we have a clue yet what this is really going to mean. I think these are the studies that are these are being done right now, and God help us if NIH, cuts out some of those studies and their funding. We just won't know.
Thank you, Barb. We have one other question. Actually, we have a few other questions. How can we target politicians and the greater economy to see how detrimental fossil fuels are to our health and what policies would help them besides the health evidence to make this change?
There is at this point almost a whole science around risk communication and climate change communication. And I think in this series, there have probably been some dedicated programs to communicating about climate change. And Karen, you know about most of the programming. Can you suggest any of the past programs that specifically helped with communicating about climate change? Because honestly, it's a bigger conversation. It's not a single answer. And Gina, it looks like you might be able
Did you have a suggestion?
I do. The suggestion that I have is the Global Climate Health Alliance. They have a communications toolkit that they just recently published within the past month. And I can place the link for that in the chat. We will also have it available in our resources. And in that information, they have a toolkit on key messaging and how to sort of focus this discussion more from a perspective of a health perspective. And I'm happy to put that in the chat, and we'll also have it in our resources. They have a report in both English and Spanish, French and Portuguese. So they have it in a variety of languages. They have press releases and information, and I think you'll find it very helpful, and I'm happy to put that in the chat.
And we also have a number of other resources that are available that we can send out after the session. And there's also some other toolkits related to answering that question.
Yeah,
we just have a few more minutes, so I just wanted to ask last question. How can nurses around the world be part of advancing healthier, sustainable energy future?
I think there is something that you can do in your community. There's something you can do in your city and county. There's something that you can do at the state level, the national level, and then through International Council of Nurses. So depending on where you want to plug in here, making changes within your community, see who is currently working on energy in your community. Energy is not necessarily something you think of it as a nurse's lane, but there are people in that lane in your communities that you can work in collaboration with and bring your health voice to that. At your state level or the equivalent around the globe, there are nursing organizations that may have a government affairs or legislative committee, having them work in coalitions with folks that are working on, for instance, some of the things Karen, who is with us here today, is working like crazy on state legislation and doing a really great job. And so looking at making sure we continue to build and use electric vehicles, making sure that our sources of electricity come from renewable sources, not fossil fuel plants and other fossil fuel sources. And there's legislation to promote this, and there are folks that are working on this. So you don't have to reinvent a wheel. You can plug into some of these existing political engagements that are going on at almost every level. In the US, almost every city and county has got a climate action plan. Seriously, even in our most conservative counties in California, they have a climate action plan. Looking at that at the local level and seeing how you as a nurse and your nursing colleagues and your nursing institution can plug into that at a local level is a first start if you're just beginning this.
Gina, did you have a comment? We have like 1 minute left.
Sure, yes. The only other thing I wanted to say is that sometimes I think in the broader scheme, this can feel overwhelming, but I'll encourage you that even the smallest of actions have the largest of ripple effects. So please, even the smallest thing that you can do as a nurse, as just a human, as a part of a family, part of a community, part of a nation, part of a international community and a planetary level. Even the smallest thing, I just encourage you, many small things have the greatest impact. And thank you for your time today, everyone.
Yes, thank you. Thank you. Thank you.
Yes, thank you to both of our speakers for the excellent discussion and presentation. And I